Let's take a look what is type 1 diabetes mellitus. In type 1 diabetes, our body immune system destroys pancreatic beta cells, which are responsible for producing insulin that regulates body glucose levels. It is an autoimmune state that prevents pancreas from making insulin by causing disruption of beta cell in pancreas. This slide explains the functions and association of insulin related to diabetes mellitus type 1. Insulin in the body works as a hormone that controls the amount of glucose sugar in the blood. Under normal conditions, insulin breaks up foods into glucose that we eat. Glucose is a sugar which is the body's main source of energy. Glucose crosses bloodstream and signals the pancreas to release insulin. Insulin helps glucose in the blood to enter your muscle, fat, and liver cells so they can use it for energy, or store it for later use. Type 1 diabetes is a common autoimmune condition. In the US, approx. 1.26 million people suffering from type 1 diabetes, and that number is expected to grow to 5 million by 2050. It is a most common chronic disease in the United States that affects children badly, though adults also suffering with this disease too. Anyone at any age in develop type 1 diabetes toned, though the most common age at diagnosis is between the ages of 4 to 6 and in early puberty 10 to 14 years. In the United States, people who are non-Hispanic white are most likely to get type 1 diabetes, and it affects people assigned female at birth and people assigned male at birth almost equally. While you don't have to have a family member with type 1 diabetes to develop the condition, having a first-degree family member, parent, or sibling with type 1 diabetes increases your risk of developing it. Several reasons affects and became a cause of type 1 diabetes mellitus. Main reason is the damage or removal of pancreas from the body, which ultimately stop production of insulin, which controls the level of glucose in the human body. The second reason is the automatic destruction of beta cells of pancreas, which may be an autoimmune state. People with specific strains of infectious viruses, called enteroviruses, are more likely to get diabetes. It's long been found that epidemics of mumps, rubella, and Coxsackie viruses have been associated with increased frequency of type 1 diabetes mellitus. Other research indicates that toxins in the air, water, and food might trigger type 1 diabetes in people who are genetically prone to it. Some studies reveal a higher incidence of the disease in people exposed to arsenic, while others have linked it to nitrates, ozone sulfates, and other chemicals and pollutants. Other autoimmune disease might become one of the causes of type 1 diabetes. A person whose family have a history of diabetes is at risk of developing type 1 diabetes. Hereditary predisposition is one of the main causes of this disease progression. If a person suffering from any endocrine disease, it may affect the production of insulin, and the insulin levels in the body may be disturbed, which ultimately becomes the cause of type 1 diabetes. Other psychological triggers that can cause the type 1 diabetes mellitus are respiratory or gastrointestinal infections in early childhood, rapid growth and weight gain in children, low physical activity during puberty, trauma or serious life events, such as divorce or death in the family. Stress is one of the common causes of this disease state. Patients often experiences these symptoms in type 1 disease state: fatigue and dizziness, increased thirst, extreme hunger, blurred vision, too slow healing of cuts and sores, frequent urination, including frequent full diapers in infants and bedwetting in children, vaginal or yeast infections, tingling or numbness in hands and legs or other body extremities, unexplained loss. If patient experiencing these symptoms, it's essential to see your healthcare provider and ask to be tested for type 1 diabetes as soon as possible. The sooner you're diagnosed, the better is to manage this disease progression. The more worst symptoms of type 1 diabetes are loss of consciousness, drowsiness, confusion, throaty smelling, nausea and vomiting, abdominal pain, rapid breathing. To stay connected for more healthy updates, do like and subscribe our YouTube channel.